This week, the federal government's Preventative Health Task Force released a report that outlines preventative strategies to improve the health of all Australians. The report's 39 recommendations focus on obesity, alcohol and smoking and aim to make Australia the world's healthiest nation by 2020. This will all be overseen by a new National Preventative Health Agency, which the government hopes to set up through legislation introduced to Parliament in the next few weeks. For more on why Australia will benefit from preventative health measures and why we need some bureaucracy to help us do it, competing a seventh step on a six-step program on the Reformed Junkies on the Inquiry Rehabilitation Program, Bec Petraitis. Bec, why is preventative health so important?
Preventative health? Why would you want to prevent health? See, that's what the problem with this government is, trying to tell us what's good for us and what isn't.
I think the idea was more about preventing kind of risky health behaviours, such as alcohol consumption.
I sort of see your point, but the real big issue you're missing here, Paul, is affordability. I mean, when I was 6, I loved a good Bacardi Breezer, or maybe just a $3 bottle of Lambrusco, or some Terps. But when I was 10, I moved up into, the 1987 bottle of Chateau Lafite, or some Terps. But really, what the government needs is an initiative to find a good, cheap bottle of red for the Year 9 demographic.
Bec, there was an Australian study released earlier this year that questioned whether there was actually any safe level of alcohol consumption for young people.
I guess we'll just have to keep drinking until we find it.
Okay, I think you're missing the point. It was more about the government raising taxes to reduce consumption, not just on alcohol, but things like cigarettes. Do you think maybe that will have a positive effect?
Paul, how can we ever hope to defeat the obesity crisis if the fat children can't go into their cheap, quick, puff and fix method? I mean, I don't smoke myself, but that's because all the terps, and it's very flammable, Paul. Okay,
the issue here is preventative health, preventing kind of risky health and overcoming problems before they even rise up. What do you think about that?
Oh, so the government think they can predict the future now? Oh, I'm not slogging through my medicine degree just to find out that everyone's healthy, fit, and not in need of my services.
I didn't know you were studying medicine.
I'm buying the degree online. Listen, Paul, quite frankly, I'm worried about how easily you've succumbed to this communist voodoo. I mean, if it's not broke, don't fix it. Like, people go to the doctors, and then if they have an unidentified growth, maybe an itchy rash, or they've lost a leg, then they get the drugs, and it's Darwinism from then on in.
Okay, so really the only people that actually think that's a better idea than perhaps just not getting sick in the first place is the pharmaceutical companies.
And they'd be right.
How can you think that?
I'm on their payroll.
And the health of future Australians?
Fuck them. Do you want some pills?
Thanks for your time.
No problem, Paul. I'm getting paid for this.